All right, so continuing with diabetes and why it's so bad. Rate of occurrence is higher among 5 to 7 year olds, 11 to 15-year-olds. Childhood obesity predisposes individuals to insulin resistant type 2. So, obesity is linked with type 2. Childhood obesity prevalence has increased significantly in recent years. So, not good news. All right. AMA has reclassified obesity from a condition to a disease. More than one third of adults are obese. NIH, right, now defines weight categories by body mass index, the BMI. So, BMI weight divided height meters. Obesity is excessive body weight, BMI of 30 or higher. Adrenals. So they're right on top of the kidneys. They're little guys. They look like fat. They don't look like much. Again, if we were dissecting, if this was anatomy, students a lot of times would just get rid of them, wouldn't even know that they were getting rid of the adrenals. Really important, okay? Glucocorticoids, mineral corticoids, androgens. That's the cortex. Glucocorticoids, mineral corticoids, dealing with glucose, mineral concentrations, homeostasis. Androgens, again, that has to do with male secondary sex characteristics. Cortisol has to do with lipid and lipid metabolism. So there can be hyposecretion, that's Addison's disease, hypersecretion, that's Cushing's disease, and they have pictures of that in the book. It's really quite amazing. There's a picture of a woman. Let me see, I don't think they show that in here. Yeah, there's a picture of a woman on page 454 who has Cushing's disease, and you could see the difference, right? Her before treatment and her after treatment. So, what a huge difference, right? Because it has to do with, it says, right? So it says buffalo hump, moon face, characteristic signs of this condition. Result of hypersecretion of cortisol, symptoms including fatigue, muscle weakness, changes in body appearance. And yeah, glucocorticoids, corticosterone, yeah, mineralocorticoids, so it has to do with homeostasis again. Yeah, hypersecretion, so talks about the problems we can have. Androgens, testosterone, androsterone, adrenal medulla have to do with dopamine. So again, epinephrine, norepinephrine. Again, we already talked about that with the fight or flight. Ovaries with the estrogens and progesterone, we already talked about that. Testes, right? Not only is it involved in spermatogenesis, testosterone, but also spermatogenesis meaning sperm production, but also with sexual behavior, libido, erectile function. Placenta. Usually we don't talk about the placenta, so it's really interesting that the book has this in here, right? The placenta is made out of mom, okay, maternal tissue, and the baby's tissue. It's kind of a combination of the two. But the placenta releases hormones. After about the third month of pregnancy, okay, or gestation, that's the word we use, about the third month, the placenta takes over and it releases hormones to maintain the pregnancy. So it says during pregnancy, placenta contains vascular systems of mother and fetus, serves as an endocrine gland, produces chorionic gonadotropin hormone, estrogen, and progesterone. So progesterone is what maintains the uterus. Chorionic gonadotropin hormone, CGH, okay, that is what they test for when they test for pregnancy, that hormone in the blood. Gastrointestinal mucosa, so we already talked about that. Thymus, we already talked about that. So you can see the thymus right here, right above the heart, has to do with the immune system. And it's really important during a young person's life. And as we get older, it doesn't get much bigger. It actually gets smaller. But it's really crucial in maintaining immunity. All right. Let's see. All right. So diabetes, talking about that, polyuria, Okay, so different types of endocrinology. The whole study of the endocrine system, we're talking about endocrinology, right? You could take a whole semester, just every every chapter in this book, right? You can take a whole class in, okay? Yeah. So here in your book, right? Hirsutism, abnormal condition by excessive growth of hair, especially is occurring in women. So dealing with endocrine issues. Hyperthyroidism, again, if there's too much with the thyroid hormone. So it shows the issues with hyperthyroidism. Look at cardiac hypertension, tachycardia, the heart goes too fast, dysrhythmias, palpitations. Again, this is affecting metabolism, and if it's too much, now all these issues happen. Hand-eye tremors, nervousness, insomnia, emotional instability, reflexes, muscle wasting, weakness, fatigue. Hypothyroidism, if the thyroid hormones are too low, again, the issues that they would cause. Untreated hypothyroidism can lead to goiter, Hashimoto-thyroiditis, and endemic goiter. Goiter is where the thyroid gland gets really big. So let's see. This is myxedema. Literally means condition of mucus swelling. It is most severe from hypothyroidism, characterized by marked edema. Edema, we're talking about swelling in the face, and hair that's stiff without luster. Without treatment, coma and death can occur. So this person, she's 62. It's a 62-year-old patient exhibiting marked edema. This is before treatment, and the same person 3 months after with thyroxine, right? Palpating the thyroid gland, right? Feeling the thyroid gland to see if there are any abnormalities. Okay, thyroidectomy, any ectomy, what does that mean? Surgical excision, we're taking it out. Sometimes they have to do that. Okay, drug highlights, thyroid hormones, anti-thyroid insulin. So if a person's above or below, right, we can use treatments. Catecholamines, so the tests, a lot of the tests, right, we take blood and we can look at the hormone levels. Oh, you've heard of fasting blood sugar, glucose tolerance tests. Those are looking for diabetes. HbA1c, that has to do with diabetes. Also, there's the A1C levels, identifying people at risk of developing diabetes, monitor how well blood sugar levels are being controlled. Urine tests, we could do that, another urine test. Here on the serum, so blood test, radioactive iodine, looking at the thyroid gland, because yes, a goiter is where the thyroid gets really big and actually can be fixed with food, and if they get iodine in their diet. All right, a radioimmunoassay method for measuring minute quantities of specific antibodies and antigens. Right now with coronavirus and COVID, they're talking about making assays to check for antibodies to see if people have been exposed to the virus. So when you see immunoassay, we're looking at antibodies, antigens. Thyroid scan, thyroxine, looking at blood again, total calcium, right? Again, blood tests were because hormones are released directly into the blood. So we could look at the blood and the levels of the hormone to see what's going on with the patient. Ultrasounds, right, to look. Here are some abbreviations, okay, of different hormones and diabetes, diabetes insipidus, diabetes mellitus, thyroid hormone, thyroxine, right? And that finishes up this chapter. This chapter is a big deal, okay? In the sense that we're talking about a major organ system that deals with controlling the body, okay? Specifically controlling the body via hormones. And so usually we're talking about long range control. All right, see you later. Bye.